press for joining us this afternoon. My name is John Freeman, and I'm the State Director of Healthcare for America Now, a national coalition of different organizations that have been working to reform the healthcare system for the last couple of years. We are here today because some of the benefits of the newly enacted law start taking effect. And we wanted to announce these changes in the law so the seniors and consumers of Michigan are well aware of what these changes are and what they should expect. I'm joined today by different organizations working with seniors in Michigan. I'm very honored to have them here. We have Mr. Eric Schenderwin, who is the president of the AARP. We have Mary Ablin, the executive director of the Area Agency on Aging Association. We have Marjorie Mitchell, the president of Michigan. We have Aaron Knott, activist with the Michigan Citizen Action. And of course, we have Garrett Arwa, who is the state director of Organizing for America. The benefit that we wish to announce today, which I'm just going to briefly mention, and Eric's going to talk in more detail, is the fact that there are many seniors that have to purchase life-saving medicine in order to maintain their health. And unfortunately, under the old law, there was a gap in coverage under Medicare Part D. In other words, seniors would have to spend to cover the full cost of medicine for a chunk of the cost of the medicine they needed. The new law that was recently enacted in March of 2010 of this year is going to fully eliminate this so-called donut hole by 2020. But this year, the very first step of the elimination of the donut hole is going to occur. And that is seniors who are currently within the donut hole are going to be receiving $250 checks from the federal government, from the Medicare program, to help begin offset the high cost of medicine that these seniors have to pay for in order to maintain their health. It's very important that seniors around the state of Michigan are aware of these changes so that they know what to expect. It's also important to know about this to make sure that they don't fall victim to any scam artists that may try and take advantage of seniors. Seniors don't have to do anything in order to receive these checks. The federal government already knows who is currently within this so-called donut hole, so they will be receiving a check automatically. But to go into more detail about this donut hole and about why this $250 check is going to be such a tremendous benefit, I want to call upon the president of AARP, Mr. Eric Schenderwin. Thank you. And I hope I'm pronouncing the name correctly.
Well, I'll help you out. It's Eric Schneiderman. And I'm really pleased to be here because this is a very, very good day for seniors. When we started working on healthcare reform years ago, we knew there were two basic problems. First, seniors are now paying 30% of their income for healthcare, even if they're on Medicare. Think about it. With a federal program for healthcare, they're still paying 30% of their income, and that share is going up. And the second thing is that with all of these payments, the Medicare system was still going insolvent. We think that the legislation passed in March goes a long way toward correcting those problems. First and foremost, on the financial end of things, we have prescription drugs which have gone up huge percentages in the past and are eating up the income of seniors. In the old days, if you had prescription coverage, you ended up paying 25% of the first $2,800 of drug costs. That's about $700. But then, the next $3,600, you paid 100%. So think about this. If you're a senior citizen and you have significant drug requirements, you would end up paying thousands of dollars, $4,500 or more of your own money just to get drugs you need to stay alive. Under this new program, that problem will be eliminated. Here's how it works. In the year 2010, if total between your payments and federal payments, $2,800 of drugs have been purchased, you will get a $250 check. Next year, in 2011, if you use up to that $2,800, $700 of your money and the balance from the federal government, you will start getting help with the next $3,600. In fact, for prescription name brand drugs, you will get a 50% discount. So that if all your drug requirements were name brands, right off the start, you would save about $1,800. And then that portion you would pay would slowly diminish so that by 2020, all you would pay is the 25%, and between the Medicare program and other payments, the other 75% would be paid. This is thousands of dollars of saving for seniors. The second thing that will occur under this new bill is that the solvency of Medicare, in fact, will be extended for the foreseeable future, for at least 12 years. And another thing that seniors have always asked us is, will I be able to keep my same doctor? The answer is yes. Will I be able to keep my same health plan and benefits, more important? Will those guaranteed Medicare benefits be available? And the answer to that question is yes as well. But part of the cost savings and part of the great new way of delivering health care is going to be prevention and wellness. And under this new legislation, for the first time, all Medicare recipients will have the opportunity to obtain free preventive care. Free checkups, free mammograms, free colonoscopies, and other tests will be evaluated and added to the list where there are no co-pays or payments required. Now that is good news, and in addition, if you're concerned about long-term care, a new option will become available next year that will allow people to contribute their own money. It's self-financed, not subsidized, and they will have a policy that will help pay for long-term care. In summary, the goals that we set out to achieve, and I know are shared by each and every organization up here, were to preserve the solvency of Medicare, to try to control the costs, and to try to stress prevention and wellness more than hospitalization. This law makes huge strides toward all of those goals, and I think will give seniors a confidence about their health care future. Thank you very much.
Thank you.